Welcome to Crush USMLE Step 1 Pharmacology lecture, which I'll be talking about aminoglycosides, also known as protein synthesis inhibitors. Now, these drugs are known as protein synthesis inhibitors because they affect bacterial protein synthesis. Now, this is different from eukaryotic organisms such like human beings because these drugs do not work on the ribosomes of eukaryotic organisms because eukaryotes have 80S ribosome compared to the 50S and the 30S subunit that's found in bacteria. So, the first thing we need to know is what are the mechanism of action of the drug, because this is very high yield. If you understand the mechanism of every single drug, you're going to be able to know exactly how these medications work and why they work. So, mechanism of action. We already said they are protein synthesis inhibitors. So let's go to the right side of the board and talk about protein synthesis. Well, how does protein synthesis actually occur in bacteria? Well, normally you have a line here. We're going to have the messenger RNA. And the messenger RNA has a 5' end and a 3' end. Now, for protein synthesis to occur, a 30 subunit, a 30S subunit has to come and sit right here. So we're going to call that a 30S, okay? 30S subunit has to sit there, and a transfer RNA, also known as tRNA, has to be able to come and sit here to bring in an initiation codon. So let's try to draw a transfer RNA, okay? And at the bottom, it has some codons that are gonna try to align and match with it, okay? And that codon will carry a messenger RNA. Let's call it methionine. You should use the first one. So it sits right there. However, the 50S subunit has to come over right there. 50S subunit, which has 3 sites, okay? It's an E site, a P site, and an A site. A for amino acid, and P for the peptide unit, peptide site. And the E site, surprise, exit. I didn't think scientists would try to be really smart with that. It's just an exit, right? You're coming. So what happens is this transfer RNA comes in and brings a messenger RNA. It brings amino acid methionine to the site to form an initiation complex. And that's very important. You must remember that. Initiation complex. Once this initiation complex is formed, another tRNA can come over. Okay, another tRNA can come over with its codons, carrying another different kind of amino acid. Let's call it a proline. Okay, let's call it proline, to come and bind to this site at the A site. Now, once the initiation complex is formed, the next step is called the elongation stage. And elongation simply means that the 30S and the 50S subunit, which I forgot to label here, okay, 50S subunit and the 30S subunit form the complex, and they will elongate by moving along this messenger RNA. Okay, they try to read the codons on it. Now, this tRNA, which is just a simple transfer RNA is going to bring this amino acid and come and sit at the A site. And what happens is you basically get something like this. Okay? You get they sit next to each other. This brings another messenger, brings another amino acid. So this is proline and this is methionine. And what happens is they form a bond, a peptide bond together, okay, right on the line, and they elongate to move to the next line. And once the bond is formed, this guy gets taken off, which is the first transfer RNA, and it goes through the exit, okay? And then it leaves, and then the next tRNA comes, and then you eventually form a nice, beautiful, okay? Nice, beautiful polypeptide chain. Poly means many, right? So it's going to be different amino acids, of course. You know, maybe let's put this as arginine, and maybe the next guy is histidine, and basically the story continues. All right? So that is a normal formation of protein synthesis until you get to the end codon. Okay, stop codon comes and ends the whole process. And you get this nice little protein, and the protein can fold, and when it folds, maybe forms something nice and goes to the endoplasmic reticulum, or it probably goes to the cell membrane and does its job. Okay? Well, that is normal. Now, we've got drugs that can help us kill bacteria. That's interesting because that's basically the whole point of antibiotics, right? It's against bio, which means life. So we try to kill life, well, we're trying to kill bacteria's life. Well, it sucks for the bacteria. It's good for us because we don't want them to make us sick. So we don't want them to make these proteins because these proteins are going to be, like endotoxins. Ooh, right? Endotoxin that can cause sepsis in patients. We don't want them to do that. So we're going to figure out a way to kill these bugs so that we can survive and they can die. All right? So here's where the fun begins. So we're going to be looking at aminoglycosides. Amino, look at the word amino acid glycosides. Has a sugar in it too. All right? So let's talk about which part of this whole process, where do they come into play? Well, their job is to stop or inhibit the formation of the initiation complex. Okay? And also, they prevent protein formation by inhibiting translocation. So translocation is just a big fancy word from this guy moving across the codon and just forming a nice little polypeptide. So we're going to go to this side of the board and take a look at this nice pretty drawing, and I'll actually see where the aminoglycoside is actually working. So aminoglycosides first inhibit and irreversibly bind to the 30S ribosome. Wait a minute. Well, this is the 30S ribosome. Okay? And this is the 50S. So let's draw aminoglycosides. So we're going to use them. Let's use red color for that. So let's take an aminoglycoside and let's gonna make it to sit right there. Okay? Let's take an aminoglycoside and make it sit right there. So that's an aminoglycoside. And this is the 5' end and the 3' end. Okay? So that's the drug. When it sits right over the 30S ribosome, what happens? Wait a minute. Oh, the tRNA cannot come and bind, right? It can't bind to the 30S anymore. So we cannot form the initiation complex. So no to initiation complex, okay? Initiation complex. And then, since we cannot initiate the formation of amino acids, so we cannot make polypeptides, right? So we're going to inhibit translocation. So now we cannot form this nice little, see how these are nicely formed? Well, that's not going to happen because we're going to prevent translocation of the messenger RNA, which means the bacteria cannot make. So when we can, so let's put here 2, no translocation. Let's see the result of that. What happens? Well, that means there is no protein synthesis, which means there is no bacteria. Bacteria dies, okay? All. That's unfortunate, okay? The bacteria is going to die. And this is exactly how aminoglycosides work. This is how they kill bacteria. Now, aminoglycosides are very interesting drugs because they do penetrate most body fluids very, very well. So they accept the CSF, okay? So they don't penetrate the CSF very well, so they're usually not used for brain infections, okay? But unfortunately, although they can go to your brain, okay, they can go to the kidneys. Ooh, they love to sit in the kidneys, so they can actually accumulate in the kidney cortex, okay? That's why they can cause a side effect, which we're going to talk about later, so keep that at the back of your mind. And also, they can go into your ears and cause some damages, okay? So we'll talk about that later on, okay? I just want to put that out there so we are aware of this. Now, let's talk about the different kind of aminoglycosides exactly that you need to know for your exam, okay? So I have a mnemonic for people to be able to memorize, so you don't have to keep too many things in your brain. That's what I'm here for. Make this very, very easy. Let's make pharmacology really, really easy, okay? So we have, the mnemonic I have is no tags. Huh. You know, it's almost like putting no tags on your shirt. Well, no tags stands for neomycin, okay? Tobramycin, amikacin, gentamicin, and streptomycin. Wow, no tags. See, the no is almost like a nil, so that's how I remember it. No tags, okay? So these amino acids, they have the no tags antibiotics. That's how I keep them in my mind. But how do I actually recognize them when I see them on an exam? Oh, see, here's the trick. Look at the word. They always end with a mycin, 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 mycin. The only one that doesn't end with a mycin is the amikacin. But other than that, all of them end with mycin. So if you ever see the word mycin, that should be telling you, oh, wait a minute, I think we are thinking about an aminoglycoside, okay? MYCIN. Remember that. That's very important. But the mnemonic is the most important. No tags, okay? No tags, neomycin, tobramycin, amikacin, gentamicin, and streptomycin. Now, aside from knowing the drugs, we have to know what kind of bugs this guy kill, huh? Well, before we talk about what kind of bugs these guys actually can kill, let's talk about how the drug actually gets into the body. How there's something special about aminoglycosides. Let me tell you. So here we've got a cell. Okay, they've got a nice little membrane. Okay, and we have to get the drug. Let's say this is the drug. Okay, let's say this is an aminoglycoside, and it wants to get inside the cell. In order for these drugs to get into this bacterial cell, they need oxygen. They need oxygen. So we're going to use oxygen, O2, and attach it to it. So it's an oxygen-dependent movement to transport this aminoglycoside with the tobramycin, amikacin, streptomycin, or neomycin to get them inside the cell. So what I'm going to do is I'm going to open the door and then get this antibiotic, inside the cell. Remember, most of the action is actually happening inside the cytoplasm. Remember, that's where the endoplasmic reticulum is. That's where the protein synthesis is going on, okay? So we want to get this guy over here. So it's an oxygen-dependent delivery. Well, last time I checked, human beings, which are eukaryotes, we live with oxygen. We cannot live without oxygen, right? Correct? You try to close your nose for a minute there, and you see how hard it is to live without oxygen. So these are oxygen-dependent medications, which means they can only work on aerobic bacteria. Huh, wait a minute. Only aerobic bacteria? Well, look at the word aerobic means they need air to breathe. They need air to breathe. That's a very, very important point because the bacteria that we're going to be killing with these drugs are gram-negative organisms. Gram-negative organisms. So let's find out which one of them we're actually going to be killing with. Well, the first one that we can kill this drug with is E. coli. E. coli, okay, so E. coli, that's one. The next one that can be killed by this drug is also Pseudomonas. Pseudomonas, okay. The next drug is Klebsiella A, all right. Klebsiella can be killed by this drug. So these are gram-negative organisms, which means they are aerobic bacteria, which means since they're using oxygen, we can kill them with aminoglycoside. And the last but not the least is Enterobacter. So like, oh man, how do I remember all these drugs? Well, this is how I remember it. See, these aminoglycosides like to peak inside bacteria. Oh, you're cheating. What are you talking about? They're peeking into the cell. Well, it likes to peek because it has a little eyeball and it likes to peek inside the cell. So peek stands for Pseudomonas, E. coli, Enterobacter, Klebsiella. Wow. That is how you make pharmacology simple. Okay, that's how you make pharmacology simple. All right. Also, sometimes we might add another drug to an aminoglycoside to cause a synergistic effect to be able to do more damage to the cell and cause a suicide bombing. Okay. Now, on the boards, they're gonna want you to know exactly what the side effect of the medication is. That's what they love to test stuff like that. And we're gonna knock this out so we can get all the baby points, right? We're not gonna keep anything behind. So remember, I told you at the beginning of this lecture that these drugs, they love to deposit in which part of your body? Let's thinking. Wait a minute. I think I remember. We said they don't like the brain, right? They don't like your brain. Oh, no, not to the brain. All right, fine. So we should be thinking about the kidneys. Oh, remember the kidney has a cortex. And I told you that these drugs, they love to deposit in the cortex, which means they can damage the kidney. That's what we call nephro, okay, from nephrons, toxicity. Huh, wait a minute. So they can damage my kidneys. Yeah, unfortunately, that's one of the side effects. But look at the shape of the kidneys. Does it look like something you used to listen to me that you're using right now? Wait a minute. Yeah, that's the ears. So they can also damage the ears, causing ototoxicity. Okay? So toxic to your ears and toxic to the kidneys. They look the same shape, so that's how you remember them, okay? Ototoxicity. So remember, the mnemonic was no tags. No tags. So how do you remember aside from the neomycin, This N stands for nephrotoxicity, O stands for ototoxicity. And the drugs, they like to peek into the cell so they can go and stop the 30S codon, the 30S codon to prevent the initiation complex. And that's basically all you need to know for aminoglycosides. So let's have a quick review. So what do we need to know about aminoglycosides again? Number one, all right, you have to know that they are oxygen dependent, okay? Oxygen dependent medication. Mechanism of action, they knock out the 30S by preventing the initiation complex, all right? And they prevent translocation, which means no protein synthesis, and the bacteria is going to die because it has no protein, all right? What are the name of the drugs? No tags. Neomycin, or neomycin, tobramycin, amikacin, gentamicin, streptomycin. Repeat that. Neomycin, tobramycin, amikacin, gentamicin, and streptomycin. All right. And what are the side effects of adverse drug reaction? Well, this is how they're gonna test you on the boards about it. They will tell you, oh, we've got a 30-year-old female that presented to the ED with chief complaint of urinary tract infection, right? She's having dysuria, urinary frequency, and urgency. The patient was started on the medication 2 days ago and now complains of deafness. Complains of deafness. Lab work was done and the patient has elevated BUN and creatinine. Wait a minute, that's not good. That's renal failure, right? That means the drug is what drug is causing this problem? Well, what you need to know is they're testing you on aminoglycosides. They cause nephrotoxicity and ototoxicity. All right, that brings us to the end of aminoglycosides, also known as protein synthesis inhibitors. Thank you very much for watching. Don't forget to subscribe to our channel. Have a good day. Bye-bye. And also make sure you go to our website, www.crushusmle.com or ftplectures.com to watch more fun pharmacology lectures. Bye-bye.